Good morning, everyone. We wanted to welcome you to the Social Determinants of Health Background and Best Practices. This is Melissa Davey, the Community Engagement Coordinator from Adirondack Health Institute on behalf of ADK Wellness Connections, our referral network. So in a couple minutes, Martine's going to get started. I just wanted to go through some logistics. First of all, this webinar will be recorded, and we will be sending a slide deck after, and it's going to be available for those who could not attend today. If you do have questions throughout the webinar, please chat them in. We will address them at the end of the webinar. And I just want to do a quick sound check. If someone could just please acknowledge that they can either hear me or chat, that they can hear me through the chat function. I just want to make sure that's working properly. Perfect. Okay, so our presenter today is Martine Hackett. Dr. Martine Hackett, she's the Assistant Professor of Public and Community Health Programs at Hofstra University and the National Center for Suburban Studies and Suburban Health Equity Institute. So I will let Martine get started. Martine, are you there?
Yes, I'm here, Melissa. Thanks so much. Can you hear me? I hope so.
Yep, we can hear you great.
I was going to say, if you can't hear me, I don't know how you would know that I was talking, but let's details. Okay, great. Thanks. Hi, good morning, everybody. Welcome to this webinar this morning. I appreciate your time and presence here. And as Melissa mentioned, we're going to be recording this webinar, and also I encourage you to chat in questions either during or after this presentation so that we can investigate these ideas a little further. So to begin, I am me, Martine Hackett, as Melissa mentioned, and I am also, starting in September, I'll be the director of our Master of Public Health program here at Hofstra. And so you can put a face to the voice, and feel free at any time if also you would like to connect with me via Twitter, and that's my handle at Public Healthy. So let's get started in terms of thinking about what is the purpose and what we're looking to cover today. So I'm going to start off by talking about sort of laying the table for thinking about what are some of the problems. And when I say problems, I want to say really thinking about this as these are challenges that I'm sure that many of you have encountered before there was DSRIP or Medicaid redesign, and that you will be encountering afterwards as well. So in terms of laying out these local population health statistics, I'm really looking to sort of set the stage for things that you already know by putting some numbers and some details on those different topics to paint that picture of what we're looking at when we look at your Adirondack region. I'm then going to go into talking about what are some of the causes of these problems. And very specifically, I'm going to be talking about the social determinants of health. And so I will be defining social determinants of health and also identifying why is it that we are hearing so much about social determinants of health? What is the big deal? What is the cause and the concern? And why are these social issues things that healthcare providers are now increasingly being tasked to deal with? And so I'll be talking a little bit about that and some of these concepts, and then finally sort of ending with the idea of what is it that we can do about it. And of course, there are many things on many different levels that can be done to address these social determinants. But insofar as you all are concerned, I'm going to talk about some tools that include screening, engaging, connecting, and advocating, as well as identifying some best practices. Okay, so that's the plan for us for today. So again, I'm going to start by just identifying something that many of you already know, that there are health disparities in rural areas, and that these disparities reflect the impact of low socioeconomic status and generational poverty, among other social issues. And so I think one of the things that is going to be quite clear after, hopefully at the end of this presentation, is recognizing that the conditions where people live have a very strong influence on the health of the population. So speaking of the population, here are the counties that the Adirondack Health Institute serves. And this is looking at a concept called, an indicator called percentage rural. And you see here that basically almost all of the counties fit under this category in terms of the percentage rural in the number in the population, where we also see that it's much larger than it is in overall in New York State. When it comes to the idea of adult obesity, which we know is a risk factor for many different types of chronic diseases, and I would also argue, right, a result of many of the social determinants of health, we see that the counties in the Adirondack Health Institute are, most of them are above the average percentage of adult obesity in New York State. Again, identifying these as potential risk factors, but also identifying adult obesity as an outcome that, as a consequence of these different conditions of living in these counties. This indicator is called limited access to healthy food, and what we see here is also a big difference in terms of the counties in the region that are higher than they are in overall in New York State. And so this limited access to healthy food, again, should be no surprise when we talk about the idea of the space and the rural nature of these different counties, and that connection to then adult obesity and other health outcomes. This indicator is called percent free and reduced lunch. And percent free and reduced lunch is something for school-age children, and it is a federal formula that decides how many of the children in a particular county would qualify for this free and reduced lunch based on family income. And what you see here is that many of the counties represented have at least a third, if not in some cases half or more than half, of their populations of children, school-age children, who would qualify for free and reduced lunch. Again, this is a way of understanding that in these counties, not only are there issues in terms of access to things that help support health outcomes, but that there is also a connection between the living conditions that people are in that their qualification for free and reduced lunch is something that demonstrates a lower income. We know that transportation is vital when it comes to living for most health conditions, and to be able to access health conditions and the qualities that ensure healthy outcomes for populations. This is particularly relevant in the counties in the Adirondack Health Institute region. And so looking at in some of these counties, we see that the percentage of households that have less than or equal to one vehicle available, that there are many of these counties where there are that qualify under this. And so we can connect the dots to recognize that if there is a lack of transportation in these counties, particularly in these rural counties where transportation is so vital, that this is also something that will connect to the health disparities or differences that we might see within the county and compared to the rest of the state. This indicator is looking more specifically at a particular chronic health outcome, diabetes, and actually more specifically diabetes mortality. So diabetes mortality is someone dying of diabetes, which just as an aside, we know that diabetes is a chronic disease, and if it's managed appropriately, doesn't have to be a cause of death. And in fact, when it is a cause of death, that sort of tells us something, right? It tells us that this chronic disease had not been managed appropriately through diet and managing blood sugar levels. So when we see diabetes mortality rate, it's sort of, there's, a story, but underneath that story, right, when it comes to identifying what the reasons are behind that outcome. And so this is looking at Fulton County data from 2014 to 2016, showing that by race ethnicity that there is a difference in diabetes mortality rate. And of course, I recognize that the racial ethnic makeup of many of these counties is not the same as it is by where I am in Long Island and New York City. But even considering the relatively small numbers, this is a rate, and this is a rate meaning that it is comparing, it's able to compare apples to apples. So even though there is a smaller Black or Asian population in Fulton County than there is the white population, the mortality rate for diabetes is still higher among, and again, you can see very significantly higher among the Black and Asian populations than among the white populations in Fulton County. This indicator is looking at stroke mortality. And so stroke mortality for St. Lawrence County, again, recognizing that the distribution of these different racial ethnic groups is different in numbers than it is downstate. This rate represents, again, apple-to-apple comparison in among the different racial ethnic groups. And here we see that, again, someone dying of stroke, what's the reason behind that reason, right? So it could be hypertension or other cardiovascular issues that don't appear overnight. And so they are, again, chronic diseases that often build up over time that are a result of the environment, stress, lifestyle behaviors, the whole gamut. And so when we see these differences in something like stroke mortality in St. Lawrence County by racial ethnic groups, again, we see that these differences tell us a story perhaps about what else is going on that resulted in such a striking disparity in these mortality data. So I have a quiz for you guys. Guess you didn't know that you were going to be quizzed today, but good news, no grades are being given. So we have two quizzes. I have two quizzes in this presentation today, and here's the first question. On average, which of the following is the best predictor of one's health? A, whether or not you smoke. B, what you eat. C, whether or not you're wealthy. D, whether or not you have health insurance. Or E, how often you exercise. So I'll give you a second to just sort of, again, I have no way of knowing whether you are answering this correctly or incorrectly, but just think about that for a second in terms of, again, looking and thinking about what are those predictors or indicators of population health outcomes. What is the strongest indicator? And it turns out that the answer is C, whether or not you are wealthy. And this becomes something that might be a little counterintuitive. People might think it has to do with health insurance or even access to healthy foods if you wanted to kind of get into the idea of thinking about social determinants of health. But it turns out that when we look at these concepts of the reasons behind the reasons for these different health outcomes across the different counties, we have to take into consideration that socioeconomic status really plays a significant role, and even more specifically, poverty is a very strong indicator for, again, poor population health outcomes. And in fact, the higher you go up if you can imagine socioeconomic status as a ladder, with poverty sort of being at the bottom and being in the 1% at the top, and a ladder that goes up across different rungs, the research is fairly clear to say that there is a very stepwise improvement. As the higher you go up the level of the socioeconomic status ladder, the better your health outcome is, again, on a population level. So again, the best predictor of one's health is whether or not you're wealthy. And again, this is not to say that all poor people are unhealthy and all wealthy people are healthy. But again, we're looking at populations and looking at this on an aggregate level, and certainly that the data are quite clear to say that there is that wealth is a strong predictor to overall better health outcomes. Okay, here's a lot of words where I am now defining this concept of social determinants of health. And again, I'm sure some of you have heard this term before. Some of you might know a ton about this phrase, social determinants of health, and recognize that it is a phrase that is being discussed quite often in many of our circles. And I want to argue that all of you have a connection and an understanding of what the concept of social determinants of health are, because you are, living in these counties, you're living in New York State, you are driving, to work, you are seeing other people in the supermarket, or you're seeing other people in the, store. The idea is that we fundamentally understand what the concept of social determinants of health are, because we, exist and live in this society. And so let's take a step back and just look at defining this. So one of the concepts that's important to recognize for the social determinants of health is that we are looking at sort of a more overall holistic set of conditions and environments. And when we talk about environments, we're not talking strictly about this idea of environment like with the EPA or something, just water or air. An environment is the sort of all of the surroundings that are around us, where we, as this says, born, live, work, play, worship, and age. And so the environment can be your conditions. So these conditions could be a physical setting like a school, a church, or a workplace, or a neighborhood. And it can have that physical aspect to it. But I also want to emphasize that social determinants of health in terms of an environment, in terms of a condition, also includes the quality of the condition of that environment that you're in, also includes the density or lack thereof of that environment that you're in, and also includes the idea of the what is available for you within that environment. And so these ideas of social determinants of health bring into, sort of weave together these concepts of the relationship between place and health, the relationship between the resources and the quality of resources available in those places, and also recognizing that those resources that some resources are better than others, and many of these resources also are correlated with better health outcomes. So when we're talking about an environment like where you live, is your housing safe and affordable? That is going to have an impact on the health outcomes of the people who live there. So again, living in a safe and affordable housing in general will sort of be a positive factor for a population's health outcome, and unsafe and unaffordable housing is, again, in general, an indicator for poorer health outcomes. And of course, recognizing that any one of these things on their own are not sufficient to be able to create sort of these, monumental changes. And we'll talk about that in a little while, about, the sorting of some of these social determinants of health and which ones sort of have more of an effect on one's health outcome than others. Because not only is where you live, which seems pretty straightforward, have an influence on your health, but so do things like access to education, public safety, and the environments of being free of toxins. And so again, some of these things are pretty straightforward in that, I guess if I lived in a place where the water is clean and the air is clean, that's going to be better for my health outcome. But also recognizing that many of these outcomes are also connected to what we talked about earlier, the idea of that socioeconomic status. And in general, the conditions that lead to lower socioeconomic status, again, indirectly are going to also lead to those poorer health outcomes. So social determinants of health, and we're going to talk more about this right now. When we think about this idea of the contributions to population health, or the contributions to, again, the health outcomes of a population. So whether you're thinking about a population are the people who live in a particular county, or a subset of that county, or an entire region, the Adirondack Health Institute region, the idea is that when it comes in general to what contributes to population health, we just talked about the idea of social determinants of health. It turns out that that social and economic conditions and the physical environment, so those are the two boxes all the way on the screen right, they contribute to 50% of the health outcomes of a population. So the things like our health behaviors, what are you eating, how often are you exercising, whether or not you smoke, are absolutely 100% significant to affecting a population's health outcomes, absolutely. But it is not the only thing. And in fact, it accounts for about 30%. And again, I also want to just sort of couch this to say these percentages are not like, carved out in a person's body, right? Like, here's the 30% that's affected by health behaviors, and here's the 20% by clinical care. And so we recognize that this is something that is, a way of trying to understand this on a population level, and is a sort of a measure to help us to understand this. The sort of bigger point is to recognize that things that many people have been focusing on for many, many years, right? The idea of improving, if you just improve those health behaviors, that's going to lead to better health outcomes for you. Or clinical care, if you have access to health care, if you have health insurance, and if that care is actually good care and responsive and responsible and health literate and talking in your language, that's going to be the thing that will improve health outcomes. Here's the thing, these two concepts, health behavior and clinical care, are necessary but not sufficient to be able to improve overall population health. Why? Because it turns out that the things that we're not looking at, the things that are basically invisible when it comes to seeing a patient or a client, their social economic conditions, that accounts for about 40% of their health outcomes. So whether it's the level of educational attainment, whether they're employed, how well they are employed, the safety within the community. And what does the safety within the community contribute? It contributes to the amount of stress that people have in those communities that they are living in. So if there is something that's stressful or feels unsafe in the neighborhood and the community that you're in, again, it's invisible, but it is going to take a toll on your body and your systems in terms of how you are reacting to stressors. And so that idea of that social economic contribution to health being 40% of population health outcomes, and added to that physical environment, air and water quality and housing, those two together are about half of the health outcomes of a population. Again, when we're thinking about social determinants of health, we have to recognize that it's not the only thing, it's not everything, but it is a big thing in terms of recognizing of if we don't address those and acknowledge them and attempt to change them, it's going to be very difficult to move the needle in overall population health. And I think that one of the things that is, again, somewhat counterintuitive is that much of our understanding and beliefs have to be around this idea of the health behaviors of the individual and the provision of clinical care. Again, necessary but not sufficient to be able to understand the overall health outcomes. And another thing is to recognize that these are areas that have traditionally been looked at, but that we have shifted as the research has shifted to understand that the social conditions that we live in also affect our overall health. And so the social determinants of health, another way of thinking about it is that you see the red semicircle that says individual lifestyle factors, right? So this is, again, what we are eating, how much we're exercising, smoking, not smoking. Those are those individual lifestyle factors. Those individual factors are influenced by our social and community networks. So who are the people that you're connected with? What are the people who are your peers? What are they doing? That is going to have an influence on, again, whatever those outcomes are. They're going to have an influence on your the choices and decisions that you make. And guess what? That social and community networks are influenced by things like the housing, whether or not you're employed, your living and working conditions, your educational level, and all of those things are influenced by our general social, cultural, and environmental conditions. And so one of the things that's just important to recognize when it comes to addressing the social determinants of health is that when we're looking to make population level change, we have to be able to look at these higher levels to be able to make those kinds of changes so that it trickles down into those individual lifestyle factors that then do influence our overall health outcomes. So I invite you to think about the social determinants of health as a more holistic approach, recognizing that when it comes to the mind, and here I'm sort of referring to things like stress. How are we, processing stress? The idea of the behavioral health, also recognizing that our bodies, and these are many of the things that traditional medical care has been trained to be able to deal with, but to also recognize that environment writ large, the environments that we are spending our times in. Here's the thing, when it comes to dealing with medical care, again, very necessary, but most of our time is not spent in medical care. And so if we are looking to improve population health, we have to focus on the places and the spaces where people are spending most of their time, and that's the environments in which they live. And as part of this idea of a holistic approach, to then provide, to first acknowledge what these conditions are that people are living in that might be influencing their health outcomes, and then to provide resources and support to be able to address them. So again, I would suggest that thinking about the social determinants of health is akin to a holistic approach to dealing with population health. And I am not alone in thinking that. Our friends at the New York State Department of Health have also seen the significance of these social determinants of health, in particular as it relates to the concept of value-based payment. And so we know that value-based payment is a way for providers to be compensated that is different from the fee-for-service model that currently exists. And we also know that this Medicaid redesign with DSRIP has been moving towards this idea of value-based payment where providers are reimbursed based on how well they keep the patients. And in order to do that, again, the acknowledgement that not only is health and healthcare going to be an important factor to be able to deal with in the quality of care, but so too is the neighborhood and the environment, the social, family, and community connections that people have, the economic stability that people have, and also education are all factors. And so these are the 5 domains of social determinants of health that the New York State Department of Health has identified. And more specifically, here are the different concepts within each of those 5 domains. So when we talk about education, we're not just talking about, how much do you know about how to manage your diabetes. Education is really about educational attainment. It's about thinking about, did you graduate high school? Have you gone towards higher levels of education? Again, socioeconomic status is something that is very strongly correlated with educational attainment level. And that starts early with the availability of early childhood education, again, has long-term benefits and effects. The idea of that social, family, and community context. So again, here are things that are traditionally have been outside of the realm of what behavioral health or clinical providers have had to be able to provide. I would argue perhaps that some behavioral health and social workers are familiar with these concepts. But certainly, again, on the larger scale of what we're looking at in terms of Medicaid patients overall, this idea of caring about whether or not people have social cohesion, or are they socially isolated? Recognizing that perceptions of being discriminated against and unconscious bias play a role. Recognizing that whether or not people have been incarcerated or not actually does play a role in overall health outcomes. Yeah, these are things that, again, the research has been quite clear to be able to make those connections between their presence and the poorer health outcomes on a population level. Of course, we understand that health and healthcare is a very necessary factor, but that also includes the idea of health literacy, or people understanding the information and what to do with it once they do receive care. We've talked about the idea of the neighborhood and the environment, and affordable and quality housing, and crime and violence, and access to healthy foods, and the roles that that plays on overall health outcomes, in addition to the idea of poverty and employment, and food security and transportation. So again, these are the areas that the state health department has identified as the domains of social determinants of health, and then within those domains, here are the additional areas. And for those of you who are interested or who know about this, right, you can go onto the State Department of Health website, and there's even more backgrounds for each one of these indicators that also suggest interventions. But again, I just want to sort of emphasize that many of these are dovetail with some of the data that I presented earlier that are challenges for this, the counties that the Adirondack Health Institute serves. And finally, just sort of thinking about this idea of how do we prioritize all of these different areas of social determinants of health? Well, it turns out that there actually are core health-related social needs. There are areas of social determinants of health that are pretty clearly identified, again, through the data, that are able to connect to health outcomes, certainly on a more immediate, in a more immediate fashion. And so these are things like housing, food security, transportation, and access to utilities. And so again, while many of those all of those social determinants of health affect health outcomes, there are some of these social needs that, again, have high quality evidence that links poor health to increased health utilization and costs. That there are some of these social determinants of health that actually can be addressed by community services, and that these are social needs that are not routinely addressed by healthcare workers. And so again, here's where we start to recognize that much of this is maybe a too big a bite to chew, thinking about areas like early childhood education availability, or the idea of housing availability. But when it comes and affordable housing availability and educational attainment, for what it is that you are doing and the clients that you are serving and what you are able to do, but recognizing that there are some of these social determinants and social needs that, again, have better evidence to say that they are going to, by their presence, you are going to be able to improve some of those health outcomes. Okay, time for the second and last quiz. And so the question is, turns out that during the 20th century, that the U.S. life expectancy, so how long someone was expected to live at birth, increased over 30 years. And so that's a really dramatic increase, which meant that, it used to be, and many of you know this, that, living to age 65 or 70, whoo, you're real old. Now you could be 70-something and be running for president. So the idea is that we've seen a very dramatic change in how long we expect people to live. And certainly we know that there are unintended consequences that have happened as a result of that. But that didn't just happen out of nowhere. Which of these following factors was the most important behind this increase? Was it social reforms and increased prosperity? Was it the presence and the availability and the discovery of new drugs like penicillin and other antibiotics? Was it the development of the modern hospital system? Was it the migration from rural areas to cities? And again, this is overall in the United States. Or was it because people exercised more and stopped smoking, or stopped and smoked less? Well, if you've been listening to what I've been talking about, it turns out that the answer, which is A, social reform, should not be too much of a surprise. That in fact, again, when you start looking at the data, that it's by changing things like wage and labor laws, instituting a minimum wage, which, as we know, is still not sufficient to be able to maintain a family, but that housing codes, when we think about the quality of housing that was previously acceptable that no longer was, it turns out, again, overall in the United States, these types of social reforms and the increased prosperity and increased, availability of food and increased availability of things like, cars for average families, all of these social reforms and increased poverty are the things that contributed to the increase in life expectancy. The more people have, the more able they are to improve their overall socioeconomic status, the better their health outcomes turn out to be, again, on the aggregate population level. And in fact, research will tell us that if you equalize these different social factors, these inequalities in social factors, that health disparities or those differences will dissipate. And again, this is in some cases theoretical when we look at and control for those different socioeconomic social factors, but it just, I would argue, sort of highlights the significance of why we should care about these social determinants of health, because it turns out when we're looking to improve the health of a population, this is where we need to invest some time and energy because these are the areas that can give us sort of the most bang for our buck. So let's move on and think about or talk about the idea of how. How do we do this? How do we address these social determinants of health on individual and community levels? And what are some of the best practices that exist to be able to address them? And so I'm going to give you some examples, but also talk through about what are some options and opportunities that are available to you. So we mentioned housing briefly in terms of thinking about the significant role that supportive housing plays. And actually, we talked about affordable and accessible housing. So this is an example that is admittedly downstate and in the Bronx. This is an innovation that the Empire Blue Cross Blue Shield Insurance Company put forth to be able to explore the ways that housing, in particular supportive housing for high or super utilizers, what effect would that have on emergency room utilization? And it turns out that by providing a supportive housing network and putting people who were utilizing the emergency department very frequently, when they had stable housing, they went to the emergency room less. And in fact, there was a decrease in the number of inpatient days and, not surprisingly, a cost savings as a result of providing stable housing. So here we see an example, and this is just one example. You know, there are several examples of this across the country and in New York State, where insurance companies are realizing, hey, wait a minute, instead of paying all of these reimbursements for emergency department visits, maybe if we just, I don't know, had housing available for, the people who are people who need it, who cost us a lot of money, that we would actually save money. And it turns out that that is the case. And we are seeing more and more of insurance companies investing and recognizing that one of the social determinants of health, like housing and supportive housing for certain populations, can be a cost benefit. Another best practice, meal delivery. And so this example talks about using a meal delivery program that, again, to reduce the cost of healthcare, in this particular example of a population of dual eligible Medicare and Medicaid beneficiaries. So in this example, what they did was basically deliver food to these patients who were high utilizers, again, of these benefits, and specifically in the emergency department. And if you provide them with, nutritionally balanced meals in where they're living, you're going to have a better health outcome if your outcome is measured by less emergency department visits. So again, here's where we start to see that, maybe we should start looking at the idea of these things that fall outside of the hospital or the exam room that actually do, or where most people spend most of their time, that influence their overall health outcomes. So, continuing on for best practices, I also want to identify something that the Adirondack Health Institute and the referral network of ADK Wellness Connections has identified, which I think is just a great way of capturing the what do you do about it piece when it comes to social determinants of health among the populations that you might be serving. So the idea of starting with screening and identifying an appropriate screening tool, and I'll talk about that in a minute. Screening to identify what those unmet social needs are, and to use those tools to be able to have people prioritize those social needs. As we mentioned earlier, there are some social needs that have higher priority than others. So first step, screening. Second step, engaging, talking to the patients about those results, understanding how to best meet their needs. And so this piece around engagement means that we need to be able to not only ask questions, but to be able to listen, because it turns out that the people who are in these situations are the most knowledgeable when it comes to recognizing what are the priorities for that are going to lead to their better health outcomes. Third step, connect. So the idea of establishing a closed loop referral process that would help you to link to community providers who can actually help to address those needs. So once those needs are screened, once they've been established and prioritized, what do? You connect people to the places who can help to serve those needs. And of course, this is going to require collaboration across, and in particular in these the counties in this region, is going to require a very significant amount of collaboration, recognizing that some services may not be the ones that are closest. The fourth and final step here is advocate. And in particular, advocate means using data to advocate for program and policy changes. So what this really is talking about is that if people keep identifying that there is a need for, let's say, affordable housing or transportation, and you attempt to connect them to those services, but keep coming up empty-handed because there are no appropriate services available, that becomes data. What is missing becomes data that you can then advocate for. So again, it's about measuring, and what gets measured gets done. So when you can say that 80% of clients identified transportation as a need, and we were only able to serve 2% of those clients, that becomes data that 78% of the transportation needs were not able to be met. Therefore, advocacy needs to take place. So here is the social determinants of health screening tool that is currently being used by the referral networks and different partners of the Adirondack Health Institute. And so this is actually a screening tool that I happen to know has been validated. It was based off of a screening tool that an organization called Health Leads uses. Health Leads has been doing this kind of connection to social determinants of health for over 20 years. And this screening tool, again, asks these questions in a health literate way. And one of the things that you can see is that the questions are straightforward and time limited. So in the last 12 months, did you worry that your food could run out before you got money to buy more? Yes or no? In the last 12 months, has lack of transportation kept you from medical appointments or getting your medications? Yes or no? And then there's the option to say, is this an urgent need? Again, looking at the social determinants of health like food access, like transportation, like housing. Are you worried that in the next 2 months you may not have a safe or stable place to live? Here are some of the different things, yes or no. Is this urgent? Are you worried that the place you're living in now is making you sick? So again, here's where we start to recognize that by doing these screenings for the social determinants of health, this is the first step to be able to screen for these conditions with each patient and client, and then to connect with them or to converse with them to be able to have them to prioritize what are these issues that are the most significant. Because the next step, again, is the ability to connect. And so to connect and to coordinate care for individuals and families, and again, in particular with the Adirondack Health Institute and ADK Wellness Connections, Adirondack Wellness Connections, is this Unite Us technology platform. And so this platform helps to make that closed loop referral system, helps to be able to identify what those different needs are, and takes on different partners across the region that may be able to address those social determinants of health that have been identified. Here are an example of some of the different categories of services where connections can be made. So everything from benefits navigation, are you eligible for SNAP, food stamps, women's, infant, and children benefits, food assistance, including food pantries and other services, housing and shelter, legal services, employment services, transportation. Again, these are areas that we know as, also known as the social determinants of health. These are also categories that the Unite Us platform can help make some of those connections in a way that, again, sort of ups the game from the traditional way that we have, sort of many of us have been trained to do this using a social work model where we're looking to do case management. A lot of this is still the same kind of concepts, but again, taking it up a notch in terms of using technology to make this a more fluid sort of system. And then finally, advocate, right? So the idea is that we, not all of these needs are going to be met in the local region, even if every single community-based organization and social service agency is part of it. Not everything is going to be connected. Not every need is going to be met. And so recognizing this is the first step, but also, as I mentioned, measuring it and really calling it out to be able to say that, this is not acceptable and it's also contributing to these overall health, poor health outcomes. And so the advocacy piece is definitely one that needs to be fostered and continued, especially if we're looking to be able to have that overall improvement and to close those gaps in services. So guess what? You've made it to the end of my presentation. And although this may be the end of this training, hopefully it's just the beginning of our work and your work to be able to improve the social determinants of health. And so I thank you for your time and attention. And I think we have some questions that are on deck that I think, JP, you're going to be the one that will ask me those questions, and hopefully I'll have some kind of answer for them.
Absolutely. So we've had one question come in, and it's kind of a long question, so I'll read it all, and then if there's a question about it, I can answer that. Can you please talk about the difference between meeting social determinants of health versus meeting social needs? I've noticed that some groups now define social determinants of health as temporarily meeting social needs for specific patient populations. Without policy and system change or health equity focus required by social determinants of health approach, a similar dynamic is emerging around the term population health.
Okay, I understand that. That's great. And I think that this is very, very important, actually. And I think words matter. And I think that there I would absolutely agree there's a lot of slippage going on between a lot of these words. And, you know, I have my sort of thoughts as to why. I should also just start off by, you know, not start off, I'm at the end, but I just want to make clear that I'm actually a sociologist, even though I teach in public health, and that I really do sort of see these issues as larger social justice issues. And so, you know, I spent some time just now talking about socioeconomic status. Who is it that has these higher levels of socioeconomic status, educational attainment, the ability to have, you know, these kind of, you know, better jobs, even having a job, right? What kind of, you know, insurance, what kind of benefits are you having with that job, right? How many hours? Are you a contractor? All of these things are part of that larger socioeconomic system that we are all a part of in this country. And so, yes, when we talk about, you know, really true social determinants of health, we are talking about things like poverty, like those differences in socioeconomic status and class. And those are deep. They're deep issues that, again, you cannot just write a referral for. And so I want to suggest that ignoring them, you ignore them at your peril, because otherwise you are just nibbling around the edges to be able to deal with that. So that is one thing I would say is absolutely true, that when we are talking about social determinants of health, we need to be clear that what we're talking about is, why is it that there is a lack of housing or job availability in particular kinds of area, right, or other types of social benefits, right? Why is that? And those are the sort of bottom of the pyramid concepts that are really the big drivers of the disparities or the differences that we see in health outcomes. Social needs are those more immediate factors that are influenced by the differences or the disparities in those social justice perspective in terms of health, of true health equity. But doesn't mean that they're not necessary to be able to address. So if we think about something like food insecurity, right, and the ability to connect people to healthy meals, okay, that's great and completely necessary for the individuals who are in those situations. And that is more addressing a social need. The social determinants of health would say, why is there food insecurity in the first place, right? What are the reasons behind those reasons? And why are some people affected more than others? And so I think that, yeah, there is a lot of slippage when it comes to the terms and the referrals and the words and the ways that they're being used, but that when we are dealing with it, again, going back to the New York State Department of Health and how they are identifying those social determinants of health, very much in the classic definition of social determinants of health. However, their interventions and the interventions suggested are much more around the idea of social needs. So I know that's a long-winded answer, but hopefully that was helpful to somebody.
And we have another question. How have other healthcare providers addressed social determinants of health in their location? What has been found to work?
Okay, so I think that this is an ongoing question. I think that, again, per the, you know, the previous question, that are we looking to sort of dig deep to deal with these, you know, underlying issues, or are we sort of nibbling around the edges and sort of addressing some of these social needs? And so the example that I mentioned around housing and the ways that insurance companies are looking to fund housing is a very kind of significant shift, I would argue. But again, insurance companies aren't doing this out of the goodness of their heart, right? They're doing it to be able to say, hey, we recognize that these conditions that people are surrounded by actually affect our bottom line, so we're going to make these sort of untraditional investments. And so I would say that housing is a clear area where many people have identified as, and you know, there is a movement that's called Housing First that says actually housing is the first thing that you need to be able to identify in order to stabilize any other situation of folks in particular who have chronic health issues or behavioral health issues. And so, so housing is one thing that has been found to work and to be able to address housing in a way that is supportive. Another thing that's been found to work, and again, when I say work, it's like sort of in air quotes because, again, it's, you know, like I just said, that this is, we're not dealing with like the big pieces here that sort of need to be shifted. Another thing that has been found to help improve those outcomes is this idea of, again, just connecting people to services and working with these different agencies to have them have the capacity to serve other people. So even on a real basic level, you can have like, oh, look, organization XYZ provides, support around health literacy or, GED referrals, let's say, or GED, it's not called GED anymore, I recognize, but to graduate high school. That's great, but what is the capacity of that organization? So here's where we also recognize that what works is recognizing that all these referrals that you keep doing out, you also have to support those organizations so that they're able to be able to make efficient referrals and provide those services that you have gone to the trouble now of identifying. But it turns out that even just the screening for those needs and having people address them, and another thing I would say is that transportation does turn out to be a very significant factor as well in terms of just getting people to where they need to be.
Okay, we have one more question, and we have some people providing feedback through the chat option. So thank you for that. Everyone should be able to see that as well. We have one more question. I know we have about 5 minutes left. How do we overcome the barriers that healthcare providers have with asking patients about social determinants of health?
Yeah, so I think that this is definitely a generational change, right, in terms of, first of all, just recognizing that these non-clinical factors affect health outcomes, right? So that a physician would recognize that, where is the patient living? What is their way of how did they even get here today? Like that has to be their problem is something that they didn't learn in medical school, certainly not 10, 20 years ago. And so part of it, I would say, is just bringing people up to date with the data and the research that, as we just talked about, really shows that the social determinants of health do have an impact on the health outcomes of populations. Next thing I would say is, so first of all, would be to increase awareness. The second thing would be to have people recognize, like, why should they care, right? And so here's where we see value-based payment and this sort of shift now to keeping patients well becomes all of a sudden sort of an incentive to recognize, not only do I have to, recognize intellectually that this is a problem, but I have to actually identify that this might be something that influences or affects my particular patient, and if I am looking to keep them healthy, I need to be concerned about it. And again, value-based payment sort of is a little bit of a nudge to be able to get to that. And then I would say it's also about, talking to patients and recognizing that they have these needs, because this is not new, right? It's not new that these social determinants of health exist. And again, this is something that we all recognize just by living our lives, right? And so I think that part of it has to be, what are the resources available for providers to be able to do something about it? Because often, they might recognize it, but they don't ask because there is no system in place to be able to address it. So I would say, having systems in place that involve care coordinators, that involve that, an appropriate screening that's in the electronic medical record, that has that, referral service, that's a closed loop, what happened as a result of that referral, right, that can give you that data back. All of those, sort of supports need to be in there as well. So that would help a provider, I would think, to be able to do it, because, recognize it intellectually is one thing, having like the sort of like goose to be able to do it from value-based payment is another, but I need to have the systems in place to be able to make it happen.
All right. Well, we are going to try to keep to our 1 hour time slot. Martine, I wanted to thank you for doing this webinar series for us and for everyone that attended. Again, we will be sending out the slide deck in the next week or so. And again, this is the first web series in order to support our ADK Wellness Connections referral network. If you have any comments or suggestions of future webinars you would like to see, please feel free to email us on the ADK Wellness Connections team. And we would love to help you guys grow and support the network. So thank you very much, and I hope you all have a great afternoon.
Thank you. Bye, everybody. Thanks so much for participating. Take care.